Thank you for joining us, Ryan and Dr. Chavez. Ryan, I want to start with you. You've been seeking therapy for the first time, right? Can you tell us about that experience?
Yes, I was feeling very depressed recently within the last month or two, and it got to the point where it was affecting my personal relationships. And that was the point where I decided to go to the doctor, set up an appointment, and seek treatment. And
Go ahead.
it was a difficult process, I must say.
Why was that? How long did it take you to get an appointment?
I originally scheduled an appointment, and then when I went in, they told me that there was no appointment scheduled. So then I had to schedule a consecutive meeting. And then when I went in, I wasn't able to see a therapist in person until December. And after a couple of weeks, they called me and rescheduled into January. So I won't be seeing a therapist until January 12th.
Wow, that's a long time. So that must be really frustrating to wait that long to talk to someone, especially when you thought you were going to go in and talk to someone that day. How are you coping in the meantime?
I'm doing all right. They prescribed me some antidepressants, and that's doing pretty well for me. I'm trying to stay busy and stay motivated. In the meantime, trying to keep myself preoccupied. So distract myself from that. But it's difficult, and I would like to be able to seek counsel for my sake and for the sake of my relationships.
Definitely. I can understand that. Dr. Chavez, could you talk broadly about how this cocktail of cold weather, short winter days, and this ongoing pandemic can impact our mental health?
Yes, well, great question. And yeah, Ryan, I'm sorry to hear about your situation. That's sort of, I don't want to say it's par for New Mexico, but that a lot of that is going on. When we're looking at the pandemic that we're dealing with, which a lot of people came up with a new concept of pandemic fatigue. Not only is a pandemic alone creating confusion, so many mixed messages from so many different sources, we don't know in many cases which one to believe. Or are you ridiculed for wearing a mask? Are you not? Is it helping? Is it not? There's all these other things. So you throw some anxiety into that mix, or depression, or anger, or frustration. You then are creating sort of this mixture of uncertainty. And that is really difficult to deal with. I understand that for sure. And so when we think of the pandemic itself, trying to deal with it measurably by let's say start with masks, for example. Okay, whether somebody feels it's going to help or not, is it going to hurt to use it? Probably not. So let's start to kind of chip away at what is making us feel the way we feel. In my line of therapy, which is cognitive behavioral therapy, we look at thoughts which affect emotion, which manifests a behavior or an action. So if the thoughts are distorted, along comes this emotion that might be a negative emotion like suicidality or anger or, going out and doing something crazy. And so if we can learn to adjust our thoughts first and not directly go after the emotion, because when you know this in talking to a child who's emoting, they get worse the more you talk to them because they're emoting. That has to settle down. The thought has to increase. And then all of a sudden we have a little more clarity of understanding or a cognitive sort of basis of understanding. And so there's a lot of multiple things going on with this pandemic that we sort of need to address. But number one, the fact that we're stuck at home, so all of a sudden here comes cabin fever, and people are either working at home and arguing with each other because they're not used to seeing face to face all the time. And those that come home, the healthcare workers who come home and they can't hug their family. And that tactile connection is so important to survival just of our species, of being able to feel that hug or that kiss or something to regroup internally, mentally, physically, emotionally, and in some cases spiritually.
A lot of people are struggling, like Ryan, to get counseling appointments during the pandemic. Why do you think this is happening? Are you seeing this?
Well, right now I am seeing that. And part of what's happening is when we talk about healthcare workers, mental health care workers are sort of in a similar boat. and that we're getting, for example, in my case, I've had people call me who I discharged 3 years ago, who had anxiety or depression. And all of a sudden they're saying, I'm getting some recurrent, or some things are coming back to me and I'm feeling, scared, anxious, angry, paranoid, or whatever, or maybe in some rare cases, some suicidality. And so, yes, without a doubt, this is what's going on. Now, there are a number of ways to deal with that. And I mean, I'm glad that you got medication, Ryan. That's really cool, man. That was really a good move on everybody's part. On the other hand, if you contact your provider, whoever that might be, or your insurance company that has providers, I would definitely ask them if there's any other people taking clients now. If they're not, get on somebody's waiting list. And for example, right now I'll have openings. I had one, for example, today that we filled immediately, but because now, even with the fact that people are trying to get in, there are people who are canceling appointments periodically because they, for example, don't want to leave the house, or they don't want to do it on a video chat, or they don't want to do it on the phone. So there's a lot of variables because there's a lot of uncertainties in the world right now, especially with the pandemic. So I would definitely let your provider know and say, listen, please let me be on your wait list because this, I need these certain things. So by all means, that's what I'm telling people to do. And some people are getting their appointments that way.
Are you seeing people in person?
I am seeing people in person periodically. I have a big enough office that I could do that. We require masks, hand sanitizer. We take their temperature, any predisposition, stuff like that. We're very cautious of. But I would say probably over 60% are either on phone or on Skype.
And what can people do while they're waiting for appointments? Like Ryan, if they can't get in, what kinds of things, any tips you have for them?
Yes. So depending on what you normally do, for example, there's some people who are spiritual type folks. They may deal with people in their church or their whatever. That's one component. Letting family know what's happening. Because if we seclude, we end up creating and following those distorted thoughts I was talking about earlier. So if we live with those thoughts and we're all alone and we don't get feedback from other people, we then end up exacerbating the thinking, which then exacerbates the emotion, which then may exacerbate the desire to drink or to oversleep or to not get out of bed or not bathe. And so we need to create this sort of connection with people. So that would be the first thing. If you live alone, connect with folks. I know we can't do it face to face always, but connection with people is really probably the number one thing. And check in with your primary care doctor if you cannot get a therapist or a psychologist or psychiatrist. And that way they might be able to, in the case of medication, they could prescribe something for that if it's not from a mental health practitioner, but from your primary care will have stuff in their formulary, medications to help you.
There are a number of crisis lines as well. The Warm Line in New Mexico,
exactly.
Agora, So
and also bibliotherapy is not bad either. Books that are available now. You want to be very aware of what you're getting online, because that's the other thing that's, I think, causing panic within the pandemic. Is we'll read something online and it says this. Well, if you're going to do that, make sure that you're looking at things that are reputable and journals that are juried, like Google Scholar is probably a little cleaner than Google itself. Check out Medscape, different things that would give you things that you can actually rely on that are tested and reliable and valid information, instead of some guy who's putting stuff out because he feels like it on something. So be very cautious of that.
Ryan, do any of those tips and resources appeal to you? Would you add anything to them?
No, that sounds really helpful. I'd definitely like to try that.
Yeah.
Is there anything that you've been doing right now for self-care while you wait to see someone, in addition to getting medication?
I've been trying to work on a lot of art projects, doing commission work. I like to do charcoal portraits, and that's helped me.
Wow.
It's very therapeutic to me. But even then, it's been difficult to stay motivated.
The other hat I wear is I'm a musician. And so it's real important that when you talk about creative side as an artist, Okay, to access that, because you know as well as I do, sometimes your creativity can be clouded by how we're feeling, which was then created by thoughts of like, where am I? Where am I at? What's going on? When's this going to end? And so sometimes art grows out of that, obviously. So in some cases, art grows out. On the other hand, collaboration is very important. So if you have a circle of people, like now as musicians, they can trade everything back online. So that's kind of creative. You see the different talk shows, John Batista and Steve Colbert, they have their band, everybody's at home playing. So if you have a love of something, by all means do that. And if you're not a person who meditates, I would suggest you maybe look into meditation or look at things you could do on your own, whether it's Tai Chi or any sort of thing that allows you for your body not to take over and for you to control your body and your mind.
Dr. Chavez, how can people support their loved ones or friends or coworkers if they sense something might be off with their mental health?
The L word, which is to listen. Okay. Trying to fix it right off the bat does not always work. When we say, oh no, I know exactly how you feel. That's not what they want to hear. What they want to hear is that you're hearing them and being able to talk, even if you're going on for a while about this and that, because what you're doing as you're doing that is you're rearranging how you're thinking to then guide how you're feeling. So if somebody wants to talk to you, let them talk, let them say what they're saying. And then when it's over, you might say, well, what I heard you say was, to make sure that what you heard was what they meant to say. And where they may say, oh, no, what I meant was this. Because, if it's sounding very crucial or possibly going to a dark area, that's when you might say, hey, well, listen, do you think maybe you need to speak to a mental health professional? Or, in some cases in the past, I would say maybe month and a half, I've probably sent around 4 or 5 people to the ER who were, at that point where they weren't quite sure what they were going to do. And so, but with listen, that's the best thing you can do for people right now. And don't always sit there trying to fix that, but listen to it. And then in the process of the collaboration, we might be able to at least arrive at a point where we mellow things out a little.
And ask them if they need help or how you can help.
Exactly. What can I do instead of directing them?
That's a great point. Thank you so much. We just have about a minute left. Ryan, you're new to the world of counseling. How did you view it beforehand? And what about now? How's your views changed during the pandemic?
I thought that I was able to handle it myself. And I used my girlfriend a lot to help me. Well, she helped me a lot. She counseled me. And she said, finally, I'm not a professional. And while I can listen to you, I might not have the answers that you're looking for. So I think it would be best that you go and seek professional help so that we can all have a healthy discussion about it and get me the proper care that I need.
So that's shifted for you. Sounds like you're looking forward to getting engaged in this.
Certainly. Yeah, I think it's going to be really helpful. And in the long run, I think it can certainly help.
I want to thank you both for coming and talking about these important issues. And hopefully we can encourage people who are facing similar problems to seek resources to reach out when they need help. We'll try and get some of those resources online. But thank you both so much for coming and talking about those.
Thank you, Megan. Thank you, Ryan. Good luck with your treatment.
Thank you. Have a great day.